Well, let's stay with the health conversation, and as South Africa celebrates Freedom Day, we take a look at the state of the public healthcare sector. Now, some experts believe that South Africa's biggest problem is that the health needs of its people exceeds capacity. Now, the public sector is state-funded and it caters to about 71% of the population. Joining me now for this conversation is Maverick Citizen editor Mark Heywood. Mark, good morning to you, and thank you very much for your time. Having spoken to you in a while, well, on such an important day, perhaps it's good to catch up about the state of public health. Let me ask you this question, and that is, what would you say the coronavirus pandemic has exposed about South Africa's healthcare system? We're now 3 years on after this pandemic.
Good morning, Paulie, and happy Freedom Day to you to begin with. I think that the COVID-19 pandemic has exposed both the strengths and the weaknesses of our public healthcare system and of our healthcare system as a whole. I can say with a high degree of confidence that, if it wasn't for the work of our doctors and our nurses and our virologists, that many, many more people would have died of COVID-19. As it is, we have a very high death rate. The excess deaths due to COVID-19 is now over 300,000 deaths since 2020. So I think we have to see those strengths, but we also have to see the weaknesses. And, we can point to a number of weaknesses. We can point to managerial weaknesses. We can point to the crisis in parts of our tertiary healthcare sector, the big public hospitals. We can also point to the fact that whilst we paid attention necessarily to the COVID-19 crisis, we took our eyes away from the multiple other health threats that we face in South Africa, including HIV, tuberculosis, a range of non-communicable diseases, children's health and malnutrition. And consequently, as we sit here today, in April 2022, people who work in the public healthcare system are once again under huge pressure because all of those diseases are now making themselves felt, and particularly at the hospital level because people have delayed care. So, I don't think it's an exaggeration to say that we are in a crisis. We have a crisis of health in this country, and we can't overlook it because health is so central to freedom and dignity and is one of the crucial rights that we included in our Bill of Rights, Section 27, the right of everybody to have access to healthcare services.
Mark, what is the reason the crisis continues? What perpetuates the state of crisis in the public healthcare sector? Is it possibly because of the way it is funded? And if so, what needs to change?
Well, Collie, there are several factors. We have a very unequal healthcare system. You mentioned in your introduction that 70% of people depend upon public healthcare. In fact, it's higher than that. But we spend the same amount of money on that 70% as we do on the, in fact, 16% of people who use private healthcare. That's a terrible inequality in and of itself, but it also means there's very different qualities of care between public and private. It divides our health response. We saw it in response to COVID-19. We see it in response to other health conditions that we face in our country. So we have to solve this problem and create one coordinated platform for the provision of healthcare services in this country. So that is a factor. But I also have to say, Polly, that corruption and maladministration is a huge factor. From what I see in my day-to-day and interactions with healthcare workers is you can't really fault our doctors and our nurses and the people who work in hospitals and clinics. But we have a crisis of management. And because we have a crisis of management, we have a crisis of corruption and a crisis of service provision. Let me give you, one example. I'm busy writing an article at the moment about Rahima Musa Mother and Child Hospital in central Johannesburg.
Yeah.
The number of deliveries that hospital has gone from 10,000 to 16,000 a year in the last decade, but its budget has not increased. There's been no public investment in that hospital. Meanwhile, we corruptly spent 500 million rand in Gauteng on the Ashanti Gold Hospital in Coronation, which has just been closed down for COVID-19. Now, if there wasn't that corruption, we could have spent 50 or 100 million rand on Rahima Musa Hospital. We could have transformed that hospital. But this type of mismanagement is becoming a blight that is doing terrible, terrible damage to confidence and to quality.
Yeah. Before we start talking solutions, Mark, which you've already started alluding towards, interesting in your first response, whilst we're on the subject of COVID-19, you say there have been over 300,000 deaths that are directly related to COVID-19. Officially, the stats sit at just over 100,000. What are we missing, and are officials aware of the stats that you are quoting versus theirs?
Yes, officials are aware of those stats, and they have always been aware of those stats. And those stats are very reliable. They are produced by the Medical Research Council. And what the Medical Research Council has done from the very beginning of the epidemic, it has measured what it calls excess deaths. That is, the number of deaths that are recorded against the average number of deaths or the number of daily deaths in the period before COVID-19. And that is why we get to this number of I think it's about 307,000, 308,000. And we know, and they confirm this, that most of those excess deaths are directly related. Not all of them, but the vast, vast majority, probably 80, 90% of them, are COVID-19 related. So I mention those figures because they're accurate, but also because they should help us to understand that this virus, this pandemic, has been far more devastating on our health system and on our communities than the numbers that we tend to work with on a daily basis. In fact, Polly, last year, the number of deaths in South Africa due to natural causes was at its highest since the peak of the AIDS epidemic in the early 2000s. So that is the toll that this epidemic has taken. But what I want to stress is it's cost us, our families, our friends, our comrades terribly. But remember, on the front line of every COVID illness and COVID death, there has also been a healthcare worker trying to, protect that person, save their life, and often witness to their death. So there is a trauma there. There's literally a post-traumatic stress disorder that we should be recognizing within our health workforce as a result of what they have gone through.
Sure. That is huge, Mark. Final question to you, and briefly, if you can. On the solutions front, there has been the effort by government to reform the healthcare sector, in particularly public health. And NHI immediately comes to mind because that is the vehicle through which government promises to reform the public healthcare sector. Is that still the solution to South Africa's healthcare crisis?
Polly, I don't, I fully support the principle of universal healthcare and the principles that underlie NHI, but I don't think that is what we need to be doing at this very moment in time. What we need to be doing at this moment in time is stabilizing the platforms of healthcare, particularly the public healthcare system that we have in this country. We need to be rooting out the corruption. We need to be listening to our doctors and nurses and the people who work in the health system about what needs to be done to improve the management of public hospitals. We need to be prioritizing HIV, tuberculosis, continuing to keep a close eye on COVID-19. There is definitely a need for a health system recovery plan. The proposal for NHI that is before Parliament at the moment is largely to do with a funding architecture, and therefore I believe is the wrong thing to be doing at this precise moment.